Hi, my name is Brooke Copeland, and I'm an RN and Lactation Consultant here at CHI St. Vincent Hot Springs in the Anthony Childbirth Center. I've been a nurse for about 18 years, and I've been here at St. Vincent for 13. For the past 6 years, I've been an international board-certified lactation consultant. My job here is to help you with your breastfeeding needs and to teach you in any way that you need taught for breastfeeding. So some benefits for breastfeeding for the baby are decreased hospitalizations, decreased sicknesses, decreased asthma, decrease in the type 1 or type 2 diabetes. The big important one too is breastfeeding will help babies with the decrease of sudden infant death syndrome. That one should be a huge one and on top of the list for you for keeping your baby safe. There are so many benefits to breastfeeding babies. That could be a whole nother video in itself. So we can talk a little bit about moms and what the benefits for moms are. Moms, it can help decrease their risk for postpartum depression. It can help decrease their bleeding following delivery. It can also decrease their premenopausal ovarian, breast cancer, and type 2 diabetes. I know many moms and dads' main concern with breastfeeding is not knowing what colostrum is. Colostrum is our very first milk that our bodies begin to produce during pregnancy and continue to produce a few days following delivery. Colostrum is very small amounts, but it is very high in fats, carbohydrates, and proteins. Colostrum is often called the gold standard. It is the thick, often gold-colored fluid that your baby receives in the early days of breastfeeding. Although colostrum is low in volume, it's measurable in teaspoon, colostrum is concentrated in nutrients and antibodies. By breastfeeding early and often, you provide your baby with its very first perfect food. This is all they will need the first few days. So don't worry that you don't have any milk or colostrum because a small amount goes a very long way. The more often you breastfeed, the sooner your more mature milk will come in. Feeding your baby colostrum is basically giving your baby their first vaccination. The more mature milk will come in any time between day 3 and 6. How do we know that your baby is getting enough colostrum? There are a few things we watch. First, we watch the weight. We want to make sure that your baby doesn't lose a significant amount of weight while you're here in the hospital, and we also will follow the weight through the pediatrician a few days after you go home from the hospital. The other thing that we watch is wet and dirty diapers, and that's something moms and dads can help us with. The babies only need one wet diaper and one dirty diaper in the first 24 hours of life. The second day, it will go up to 2 wet diapers. The third day will be 3 wet diapers, and the fourth day will be 4. So essentially, the more you breastfeed, the more you make, the more your baby will take in, and the more they will pee. We also watch the bowel movements. The bowel movements initially start off as that black, sticky, tarry meconium, is what you've normally heard it called as. And it will go from that black, sticky, tarry to a brown, then a green, and then a yellow seedy. It will stay that yellow seedy the entire time that you exclusively breastfeed. And they may not have a bowel movement every day, but you should see that color trend throughout the week. Another way that you can see if your baby's getting enough is how they act between feeds. So babies essentially are very tense and drawn up with their hands clenched. And once they've nursed really well, you're going to start seeing them open their hands and relax their arms a little bit and sleep well in between feedings. And of course, the more you breastfeed, the faster your milk will come in, and the diapers should increase to 6 to 8 wet diapers a day. Here are some tips to breastfeed your baby and be more successful. You want to breastfeed your baby on demand. So if your baby is ready at 2 hours, go ahead and feed your baby at 2 hours, but we at least want to try every 3 hours. And we do want to feed around the clock. Some feeds may be really good and your baby awake and alert, and they may do 20 minutes on both breasts. The next feed may be a little more sleepy, and that may only do 10 minutes on one side. That's okay. We're just going to continue to watch their weight and wet diapers. Also, try to observe your baby. We use couplet care here, so your baby's in the room with you. The more you can observe and learn their feeding cues, the better your breastfeeding will go. Feeding cues are things such as them bringing their hands to their mouth, chewing on their hands, rooting and turning their mouth towards you, and licking their lips. Those are all cues that your baby is ready to begin to nurse. And so that is an awesome time to really start trying to get the baby initially latched. We also would love for you to try that golden hour after you deliver your baby to get your baby latched on. That's such an important time right after delivery. Your baby's so awake and so alert that it is an essential time that you can get your baby latched and bond with your baby. So we encourage you to do baby skin to skin after you deliver. Take some time, and then when your baby starts rooting around and looking for the breast, let us help you get the baby latched on. We're here to help you, and we're here to help you with your breastfeeding goals. So anytime you need any help, please don't hesitate to ask any of our nurses or me to come help you with your breastfeeding. We encourage you to try not to use supplemental formula during your hospital stay if you really want to exclusively breastfeed. Of course, if there's a medical indication, that's understandable, and we need to do what is best for the baby at that time. But the more bottles that you do give your baby, the harder sometimes it can be to get your baby back to breast and latching correctly. Bottle can change the flora of the gut, and it also is very paced a lot faster than what breastfeeding is. And so the slower breast milk will sometimes aggravate the baby when he's trying to get that initial satisfaction. So it can sometimes make breastfeeding a little hard trying to go back and forth. Of course, we always want you to ask for help with breastfeeding, and that's what we're here for. I'm here during the week, and when I'm not here, the nurses are all trained to help you, so please never hesitate to ask. We are excited that you chose to have your baby here at the Anthony Childbirth Center, and can't wait to see you.